Good afternoon, fellow administrators. I want to talk about gender based medicine today. As an administrator, that's the people that I want to focus on today. It's a lot different than having to speak to a provider about this. As an administrator, of course, working in a medical facility, there's more hands on with the patients when it comes to meeting them, talking to them, more than treating them, unless you work behind the facts in the clinical back office part. But in the front office or in checking people in, checking them out, having them come into your office to speak about a variety of different things. It's a different aspect. So, sex is determined by the nature of the patient, mainly their physical aspects. With women, it's the higher levels of estrogen, progesterone. They have the breasts. They go through menstruation. Men, on the other hand, it's their testosterone, deep voice, body hair, muscle, strength, stuff like that. Those are the physical aspects. But the gender is more defined as the nurture, more along the lines of who the person is, not what the person is. This is important when talking to different patients about this because even though they may look more masculine but prefer to be a woman, that's who you address them as. That's who you respect them as. My biggest thing which with treating patients or treating anybody is treat them with respect, treat them with kindness, and that will go a long way more than being uncomfortable, acting fidgety, not knowing how to approach them. Just treat them like you would treat your mom, like you would treat your dad, any family member. Be comfortable with them because if they feel that you're not treating them as an equal to anybody else, they're going to be uncomfortable. They're not going to want to open up to you. They'll be less coming with you as far as information that they may need to share with you. So, treating genders when it comes to healthcare is kind of tricky because when you meet people and you see a person physically for what they are, it's not exactly who they are. You can't base your assumptions. You can't base how you feel this person is until you sit down and you talk to them. It's huge. Gender medicine must consider the needs of both sexes, not oh well this woman looks like a man, so but we're going to treat them as a woman. That's not how it works. Physically, we need to treat them for their sex, physically, as far as medical care, because although there are a lot of characteristics with the genetics of men and women, there are many differences. Um, let's see. So, what else? I'm sorry. Um, so as far as men, when treating them, more data is needed in regards to osteoporosis, specifically with men. With women, more data is needed with treating them for cardiovascular areas. Those are two huge things that they need to be treated with. And if for some reason they're not, their health could fall to the wayside. Um, So let's talk about gender behavior. It can modify biological factors and thereby health. Exposure to stress, environmental toxins, poor nutrition of lifestyle choices can induce genomic and epigenetic modifications in adults, children, and even the developing fetus. These modifications and their physiological effects are different in women and men. As DNA repair and epigenetic mechanisms are modified by sex hormones. Um, Gender medicine therefore aims to include biological and socio-cultural dimensions and their effects on women and men to improve their health and the health care in which they're treated. This is important. It's important to see a person not only for their sex but and their gender. The biggest thing that I live by is treating patients the way that you would want to treat your mom. Room them, show them that you care, so show them that you're there to help them in any way possible, and that will go way further than just treating them for the sex they are. Thank you.